Hi, I'm Dr. Kadhim-Saleh, one of the co-hosts of the Physician Empowerment Podcast. At Physician Empowerment, we're dedicated to improving the lives of Canadian physicians personally, professionally, and financially. If you're loving what you're listening to, let us know. We always want to hear your feedback. Connect with us. If you want to go further, we've got outstanding programming both in person and online. So look us up. But regardless, we hope you really enjoy this episode. Hi, everyone. I am so glad to have you joining us on the show today because our guest is I'd say you are a very remarkable, highly entrepreneurial physician. So let me do your name first, then we'll do the abbreviated version of your name, and then we're going to get into your story because it's phenomenal. But I'm joined here today by Dr. Amjed Kadhim-Saleh. AJ is what you go by. You're a family physician based in Toronto who you did some things a little differently in terms of the first 5 years of your practice. You're still, in your first 10 years, but you did something different when you started out in practice, unlike most family medicine grads. So tell us a little bit about that journey. And by the way, you can say hi to everybody.
Yes. Yeah. Hi, Kevin, Dr. Mailo. Thank you so much for having me on the podcast. Truly an honor to be here. Yeah, absolutely. So in my second year of family medicine residency, I kind of knew what I wanted to do, which is go out there and build my own clinic. So I remember, and to this day, obviously, the sort of wisdom is to try out different things, maybe locum, maybe work at a walk-in clinic, see it out for yourself before you commit to something. And I think there's a lot of good points there to like see it from that perspective before you commit. But for me, I knew what I wanted to do, and I didn't want to hop from like sort of one place to another. So I had this vision of building my own clinic. And so in my second year of residency, I sort of laid out a plan, right? And so I ended up with my wife, Mary. We purchased a commercial condo, real estate, and it was empty. It was like sort of just concrete slab, and we went out there and we designed the place, designed it into like 6 exam rooms. We have a pharmacy that shares the roof with us. So we built that throughout my second year of residency, and then shortly
What?
after,
What?
yes, yeah,
Oh my
absolutely.
goodness.
Yeah,
Oh my goodness. Okay, I missed that. I missed that when we were talking before.
yeah,
Wow. Keep going.
yeah. So it was being built, and then shortly after residency, we opened the clinic. So we're coming to the 6 year anniversary, end of August this year. Yeah, and it was really to me, like the true power of it is like having the autonomy to have your own sort of vision, your own practice, and how you want to shape it. And there was definitely like a need in the community that I wanted to fulfill. And then I recruited other physicians to join us. So we have 4 family doctors that we run the practice. Yeah, and yeah, I mean it's different than you're right. It is different. There's a lot of like risks up front, to take up, but for me it made sense because I knew what I wanted to do and I wanted to act on that. Yeah.
Yeah. So, I mean, I feel like there's a whole episode there
Yes.
talking about not only the ins and outs of designing a clinic, what do you regret, what are you proud
Yeah.
of, what do you wish you'd have done differently, but even the dynamic of that MD non-MD spouse
Yeah.
combination, right? Because that was actually one of the themes of the conference.
Yes.
We had a small panel discussion on that issue where we had some phenomenal physician non-physician spouse couples
Yeah.
talking about their journey, and it is truly synergistic. Yeah, because you were there,
Yes.
you saw it. You should have been
Yes.
a panelist. You were far too modest.
I loved it. It was so honest.
Yeah.
The conversation, it was so real, right? That you don't get to experience that, sometimes. And just the wisdom, I remember like Kitty and Dr. Lim talking about that dynamic and like the struggles they had, and
Yeah.
So yeah, it was amazing to have that panel actually.
Wow.
Yeah.
Yeah. Yeah. Exactly. Like that was a great weekend. So for
Yeah.
anyone that's listening, we're just talking about the Physician Empowerment Conference,
Yes.
and then we had another panel on this. That was on the Saturday, and then on the Sunday we had another panel, and Dmitry Ranev was there, and he's
Yes.
master, been
Yeah.
with the Physician Empowerment family since the beginning.
Yeah.
He's a family doctor based out of Ottawa, and then the topic of AI came up,
Yes.
and we were talking about burnout. We were talking about the struggles that we all face in primary care across the country. I think a lot of it's driven by an aging population. The medical complexity is increasing. All of these sorts of things that are putting pressure on family physicians, and then
Yeah.
to hear Dimitri talk about his own journey
Yes.
in not only changing the focus of his practice but also incorporating AI. And then that's where I sort of got lost because I'm terrible. I can't even work my email. So this all feels foreign. And then you put up your hand
Yeah.
and you talk about, oh, just something else you happen to be doing in these
Yeah.
years since 2017, 2018, which is you yourself, along again with your wife,
Yeah.
this incredible team that you guys have built, went ahead and constructed your own AI called Pippen
That's right.
AI that you
Yeah.
use in your practice. So okay, again, we're going to unpack some of this. So,
Yeah.
AJ, tell me what spurred you to build your own AI?
Yeah.
I mean, obviously, you like to build things like
Yeah.
clinics in your residency years, um, which is unprecedented.
Yeah.
Unprecedented. I talked to many physicians, never heard of anything like that. But one of the reasons why I love what I do
Yeah.
at Physician Empowerment. So like, what just sort of entered your head that you're like,
Yeah.
oh, I will build my own AI?
Yeah, absolutely. And I will say, I didn't set out to do that. What I was experiencing is running a relatively large practice. I was experiencing like that administrative burden and burnout that we're talking about. And on an like sort of what does that mean to have like the burnout? And for me, it was like I felt that I was losing my evenings and weekends. I felt that they were being stolen from me, right? And I'm a father of two kids, both under 5. So, my last appointment of the day is supposed to be at 3:50. By the time I finish from the clinic and get home, it's like 7 o'clock. It's already bedtime, and I'm not spending time with my kids. So I felt that there must be a better way. And so actually I started to look at what is out there, right? What are the solutions that are available out there? And so I looked at, I've had demos of other AI companies. They came into the clinic and they started to sort of say, here's how we can help you. And I truly I commend what they're doing. They're trying to solve that paperwork problem for us. But for me, I felt that they're a little bit clunky and a little bit sort of limited in functionality. So I felt that maybe I could do something about this, right? And myself, like sort of knowing the pain points of family medicine. But we've alluded to having the team with my wife. So Mary Aglepe, she's actually a PhD candidate in epidemiology, and she has experience in AI and data science. She has expertise in managing large data sets. So we thought, why don't
Wow.
we put our heads together, right? I know the pain points that family doctors go through, and she knows like the AI and the data science. So why don't we try to, put our heads together and try to solve this problem? So that's kind of what really led to taking on this journey for us. Yeah. Yeah.
Phenomenal. Okay, so for
Yeah.
folks like me that are probably going to be not exactly the early adopter of new technology, go ahead and tell us like
Yeah.
what does it look like? Because one thing that really came out during the conference, the Physician Empowerment
Yeah.
Conference, was, I think it was Dimitri, or somebody said, like, I'm finally talking to my patients.
Yes.
I'm not
Yes.
staring at a screen. Because I remember when they rolled out EMRs, they're like, oh, it's not going to affect the patient encounter. But we all know that we are staring at our screens far
Yeah.
more than we are
Yeah.
staring at patients, right? And we're
Yes.
far more than we're talking to patients. And I think it frustrates us because we're constantly switching our attention.
Yeah.
And that was sort of the one thing that stuck with me, coming out of the conference and hearing about AI in a
Yeah.
clinical encounter. So tell me, just walk us
Yeah.
through what AI does in a clinical encounter.
Yeah, absolutely. So if done well, right, this is how AI looks like. You go in the room, you start talking to your patient. The AI is working in the background. It's sort of listening into the conversation and it's transcribing and making notes, right? You click one button and it generates a note ready for you to review. So you're basically talking to your patient. You're having a natural conversation. You're not excessively trying to type. You're not trying to remember all the little details and constantly look at the screen because if you don't put it down, you're going to forget it and you worry about missing something. So you're literally just having a conversation, maintaining having that eye contact, listening to the patient, and it works in the background. It summarizes it for you, and then it can actually a step beyond that as it gives you insights. But at the basic level, it just scribes it, right? So it kind of puts it into a medical format. So in family medicine, we use the SOAP note. Specialists use consultation note, right? So it puts it out there, and you can edit it if you want. Verify, make sure everything looks good. But really, it restores that doctor-patient relationship, right? So you think about it from a patient perspective. Sometimes they're coming to us, oftentimes, and they're like sort of telling us truly how they're feeling, the struggles they have, right? And on the other side, you're sort of trying to write everything down, right? You're looking at the screen. It just doesn't feel natural, right?
Plus, patients are jumping around, right? Or
Yes.
or we're jumping them around, right? Like, because especially in family practice, I mean, you're there to care for the whole person
Yep.
and they feel it. And so you go, oh, by the way, this, by the way, that.
Oh yeah.
But then you have to go back and ask some more questions on issue number one, right? To get some
Yes.
clarity on it, right? So there's this natural conversational back and forth
Hmm.
that you're struggling to pick up as you type, which is just a horror show.
Yes, absolutely. Yeah, you're right. So in my practice, like the average number of issues per visit is 3 to 4, right? Sometimes it's like 7 issues per visit, right? And sometimes when the patient actually leaves the room, our work begins. By work, I mean the paperwork, right? So the paperwork actually begins. You have to chart everything, you have to act on the referrals, you have to, create all the requisitions. So yeah, and it generates a lot of paperwork, and it for sure contributes to our burnout. Like, you look at the statistics, 19 hours per week that we spend on paperwork. That's all unpaid. Like we don't get paid for this. It costs us family doctors something like 96,000 to 200,000 a year of our time, right? And we don't like to do it. I've yet to find one family doctor who loves to do paperwork, right? We like to focus on the medicine, not the paperwork. So, for me, like I've always been interested in practice management and efficiency, and I've used other tools. Like I'll give you examples. I've used templates and custom forms. And the issue with that is exactly what you said. People are jumping around from topic to topic. So you end up having to put 3 to 5 different stamps to actually address the issue, right? I've used dictation, right? But the problem with dictation is you do it after the patient leaves, right? You can't do it like synchronously. So still takes time. You still have to like remember all these details. So there's a lot of like cognitive load. So this is like the evolution, right? Now we have a new technology that works synchronously at the same time, and it works in the background. So you could have that conversation without having to worry about that charting.
And then do you just have like in terms of like, letting the patient know, do you just have a sign in your clinic or a sign
Yeah.
in each workstation in the patient rooms?
Yeah, yeah, absolutely. So with our own clinic, we have signage in each exam room, and it would say like notice of using AI and audio recordings, and it has a bit of explanation. It's like a paragraph long, and then when I go into the room, I say hello, obviously to greet the patient, and then I say, before we get started, I need to get your consent. I'm using this software that does voice to text, does recording. The audio gets deleted right away, but it generates a note so I don't have to type up everything myself. I verify afterwards that everything is accurate. Is that okay? And my patients kindly, 100% of them have said yes. So and part of it is like the patients see you, right? They're seeing you going from room to room, right? They see that you're busy. So they're like, whatever you need to make your job easy. They understand we're trying to do our best. And so they actually totally on board. Many of them are like, wow, this is like really cool. So like it's, they're actually excited about it. Yeah.
Okay. And it's browser based, right?
Yes.
So you
Yes.
can just you're populating inside a browser and then you just copy and paste it into the EMR.
Yeah, exactly. Yeah. So for Pippen, it's browser based. So you don't need to download anything. It works on any device, like phone, laptop, computer, and it synchronizes between devices. So yeah, so you would just begin the encounter. When you finish, you would click end recording, and then it submits the transcript and generates the note. There's a quick copy functionality at the bottom that you use to copy and paste into the chart.
And
Yeah.
what is this, like, practically speaking, what is this saving you,
Yeah.
as a user pre AI? What were you putting for let's say mindless charting in a
Yeah.
day versus what you're doing now?
Yeah. So you know how I was saying my last appointment is at 3:50, I leave by 7. That was pre-AI. Now I'm leaving by 5. So it's practically saving me 2 hours per day.
And are your colleagues seeing this as well? Because I know you've licensed it. It's now in other clinics.
Yep.
What's the feedback been? I know you're still in those very early stages.
Yeah, yeah, absolutely. Honestly, they love it. They're sort of again, it's like sort of feeling like wow, like this is actually finally restoring my ability to do medicine in like more natural way. So they love it. It saves them so much time. There's so much efficiency out of it. So even like in addition to those like 2 hours of not having to do charting, it actually gives you additional time throughout the day. You're able to tackle some of the things that I used to like save for the end of the week, like the referrals. I used to do them just only at the end of the week because I just can't do them at the same time. But now it actually gives me that freedom to tackle some of these things up front, and it's not again stealing my weekends and my evenings, right? So yeah, similar. Yeah, we're early, but similar experience. Doctors are loving it. They want more. So I find like doctors, now that there's AI there and there's enthusiasts, they're like, okay, well, can it generate the requisition for me?
Well, I
Can
was
it?
just gonna say, like,
Yeah.
is that coming? Like, it's the next one is
Yeah.
like the requisitions.
Yep, absolutely. Why not? So if we like as physicians, we take like sort of ownership and say, let's use this technology. Let's actually make our lives and jobs easier, right? Why not? If it can do some of that, of course, obviously you need like our own checkpoints, right? You have to verify, make sure everything looks good. But if it can automate some of these tasks where it drafts it for us for to review and make sure everything looks good, why not? And I think it is coming. We're only at the beginning of this revolution in AI, so I think it will get better and better. Yeah,
Wow.
yeah,
Wow.
yeah,
It's yeah, I mean, how do you put it? I mean, we've had so many discussions within healthcare about
yeah,
things getting better
yeah,
and things, frankly, at least for frontline staff, only seem to be getting worse in terms of hospital-based care, in terms of community-based care. Specialists as well as family physicians are all feeling this pressure. And I don't think by any means AI is going to fix
hmm
the systemic problems in healthcare, but it's nice to have something that actually works.
yes,
Because I know I've heard a lot of physicians complain over the years. I personally love an EMR,
yeah,
but a lot of physicians complain about EMR just being cumbersome, right? And that was promised to improve things, right? And there's always
yeah,
new shakeups within the healthcare system, or new approaches, or the constant need to assimilate new information, and stay
hmm
up to date. It's nice to have something in the practical day to day that works.
yes,
And do you see like AI integrating like clinical decision making rules, those sorts of things
yeah.
as well?
Yeah, I think that's coming. It's interesting. The other day I was at the conference. It's called HEAL conference at Western University, and one of the talking points actually was this idea that AI will become standard of care at some point. Maybe we're not there yet,
Yeah.
But at some point, AI will become standard of care because, for example, it can, you know, make sure, for example, there's no drug interaction, just as an example, right? And so the idea that they kind of emphasize is if you don't use AI when it is standard of care, then you can be liable. So at some point, yes, it will incorporate decision tools and, decision, clinical decisions, but it's very, I would say it's early. It's more very narrow focused. So it's not sort of like broadly applied. With Pippin, actually, we have one of the prompts that it generates like a differential diagnosis, it generates a treatment options, and it's meant to be like sort of as a when you're running into somewhat challenging situation, right? You're not going to use it for a straightforward encounter, but if you compare that technology to what's currently available, like if you have a somewhat difficult case and you want to get ideas like what should I think about with differential diagnosis, sometimes people just Google stuff, right? And you end up with non-specific, non-relevant results, or they can go on to like a reputable source, but that reputable source can give them differential of like one symptom.
But even that takes time
Yes.
and distracts your attention.
Yeah, and it will generate like a differential on like one symptom, whereas with this technology, it's like a differential on a whole case. Like it understands like context. So
That makes a lot of sense because like
yeah,
to go back to your template point, right? I mean, templates were supposed to fix so much of this, but templates just are a mess.
yes,
Even for hospital-based care, you have
mhm,
a patient that's suffering from alcohol withdrawal and aspiration pneumonia and a GI bleed. And you're like, okay,
yep,
how do I integrate all of this? Because now they're not talking to each other, right?
yes, yeah. So much clicking, right? So much
Oh,
clicking,
the clicking.
filling little boxes. Like it's just. You're right. It is a mess. I think we,
Yeah,
we.
that I didn't even get on to ranting about the click box medicine that so many
Yeah,
physicians complain about as
yeah,
well, right? Which
yeah.
again, like what you just feel like a drone at
Yes.
some stage, when you have too many boxes to check.
Yeah, absolutely. Yeah,
Yeah.
absolutely.
Yeah. So I mean, I think we go on and on,
Yeah.
but this was just such a fascinating journey. And to hear it from multiple physicians talking about how AI practically made things better is so nice to hear, right? Because, like I said, many technologies are rolled out that are supposed to improve clinical performance or working conditions, and they often fail to meet expectations. So
Yes.
again, this was great, and I'm so
Thank
glad
you.
you came to the conference, AJ.
Thank you. Oh my
We are
gosh.
so glad, and thank you for raising your hand and saying, "Oh, I built an AI." And
Yeah,
it wasn't
yeah.
in a braggy way. You're such a down to earth, humble guy,
Oh, thank you.
but it was truly inspiring to hear what you and your wife Mary did.
Yeah.
And not
Th-
just in terms of this specific project, I mean, but building your own clinic while you're in residency, just phenomenal, like so
th-
inspiring about that power of focus and having a dream,
yeah.
and then going out there and actually doing it. So I wish you all the best,
Thank you so much, Kevin. And
in all your future endeavors, AJ, and we should definitely get you back on the show.
I would love that. And before we go, I just wanted to commend you for building such a wonderful community at Physician Empowerment. Like as you know, I got to experience that up and close at the conference last month, and it was truly a unique experience. Like for me, because I've been to a lot of conferences, but this one was intimate. I felt that people actually like they're curious about what you're doing and they want to help you, right? And that like I felt that people actually care, right? And so that's the community that you built with
Yeah,
Wing
that's
and yeah,
I'd say the thing we're probably most proud about is that sense of community. You just stop feeling alone.
yeah, yes,
Like
yeah,
you can pick up you can call somebody, you can email, and you're never struggling alone anymore, which is a
yes,
wonderful thing. And yeah, I mean, certainly for myself,
yeah,
the support I've gotten from so many, and not just like faculty, but honestly, like from longtime attendees or masterclass members, it's been truly remarkable. So again, thank you for your
amazing.
kind words. And like
Thank
I said,
you.
I look forward to continuing to follow your amazing journey. and we definitely have to get you back on the show. Again, thank you so much, AJ.
I would love that. Thank you so much, Kevin. Take care.
Thank you so much for listening to the Physician Empowerment Podcast. If you're ready to take those next steps in transforming your practice, finances, or personal well-being, then come and join us at phys-empowerment.ca, PHYS empowerment.ca, to learn more about how we can help. If today's episode resonated with you, I'd really appreciate it if you would share our podcast with a colleague or friend, and head over to Apple Podcasts to give us a 5-star rating and review. If you've got feedback, questions, or suggestions for future episode topics, we'd love to hear from you. If you want to join us and be interviewed and share some of your story, we'd absolutely love that as well. Please send me an email at kmilo@phys-empowerment.ca. Thank you again for listening. Bye.